we have to know what is tablet. Tablet is a solid unit dosage form of medicament. Means where unit dosage form means you can calculate the exact amount of the medicament you are consuming or you are administering. That's why it is called as unit dosage form of medicament. Next point is it consists of a mixture of API and or active drug and as well as some excipients. And what is API? API means active pharmaceutical ingredient, which is the main drug. For example, if we are taking a paracetamol tablet, then the paracetamol drug is the main API or active pharmaceutical ingredients, and other ingredients except the API is called as excipients. In excipients, there are so many things are present like binder, filler, diluents, glidants, etc. etc. Next point is why this is called as unit dosage form. Okay, here it is. Unit dosage form means the amount of medication administered to a patient in a single dose. In a single dose, the exact amount of the main API which are administered, and you can calculate the amount of the medication. That's why it is called as unit dosage form. Okay, next is the main point. What is the advantages of the tablet? First advantage is it is easy to administer. It is very much easy to administer. Next is it is easy to dispense. Next one is the main point, that is beta test of any drug can be easily masked by the solid unit dosage form of tablet. Like if any drug is beta in taste, that taste or unpleasant odor also can be masked by the tablet. Next one is accuracy in dose. Okay, next is disadvantages of tablet. There are so many disadvantages are present, but here I have discussed about only main two disadvantages. Number one is it is very much difficult to swallow in case of the children and old patients. The patients who are very pediatric or children and old patients, for them it is very much difficult to swallow a tablet. Next one is bioavailability of the drug is lower than other dosage form like parenteral and liquid dosage form. Now what is bioavailability? Bioavailability is nothing but the percentage of the drug which can be obtained in the systemic circulation after the administration. If you administered some drug orally or sublingually, then the percentage of the drug which can be obtained in your systemic circulation or blood, that is called as bioavailability. Now here it says that bioavailability of the drug for tablet is lower than other dosage form like parenteral and liquid dosage form. To the next part, preparation of tablet. There are three established methods of present for the preparation of tablet. Number one is direct compression method, next is dry transmission method, and third is wet transmission method. In direct compression method, all ingredients are directly compressed by the compression machine without changing their any physical appearance. And dry transmission method, granules are prepared by dry method, and in wet compression method, water is used or any kind of slurry is used for the preparation of wet granules. And we are going to discuss about the wet granulation methods of tablet. This is the wet granulation method for preparation of tablets. First of all, we have to this is the flow chart for the wet granulation of tablet. First of all, we have to wet all the APIs as well as the excipients. Their first is weight. Weight means simply weight. Next one is sieving. Sieving means we have to sieve the all APIs and as well as all the excipients as well. Normally all APIs are passes through the 60 minutes and all all excipients are processed through the 14 mesh. And next one is mixing. We have to mix all APIs and excipients. Next one is preparation of wet granules. Next, then we have to prepare the wet granules with the help of starch slurry or starch paste. Starch is works as binder. Or we can also use as PVP or polyvinyl pyridine as a binder also. Next one is sheaving of wet granules through the mesh number 10. Then we have to sheave the wet granules through the mesh 10. Next one is dry. Then we have to dry this in 60 degree centigrade temperature for minimum 1 hour. Then we have to check the LOD or loss of drying of that particular granules. Then if the LOD is okay or loss of drying is okay, or we have to check the moisture content also. If this is okay, then we have to shift the dry granules from the mesh 20 to 22. Next, we have to mix some lubricant here that is called as lubrication, which helps the granules these granules will not stick under the punches of the compression machine. And next, finally, after the lubrication, we have to check the pre-formation studies of the granules. Pre-formation studies means their bar density are there, tap density are there, Hausner ratio, angle of repose, compressibility index or Carr's index. If all the pre-formulation studies give the positive results, then only we can go through the compression. We are going to formulate a dummy sustainability matrix tablet, where this is the chart, where ingredients chart, where first one is dicalcium phosphate or DCP, which acts as filler or diluent. Next one is HPMC5 or hydroxypropyl methyl cellulose, which works as sustained releasing agent for which a tablet becomes a matrix tablet. And next one is lactose monohydrate, which is also works as a diluent. Next one is PVP-K30 or polyvinyl pyridine K30, which is a binder. Next one is talc, which works as a glidant here, and next one is magnesium stearate, which works as a lubricant here. This is the formula for one tablet, and we are going to formulate for 10 tablets, and this is the formula for 10 tablets. Let's go to the final experiment. Now I am going to perform the experiment. Here are the ingredients or the excipients. That is lactose monohydrate, that is polyvinyl pyridine or PVP, that is specially DCP or dicalcium phosphate, and that is hydroxypropyl methyl cellulose. And these are the ingredients which I weighted previously and shifted to the mesh 14, and that is the PVP solution, or we can also call as the slurry of PVP or polyvinyl pyridine. And here is the mortar and pestle, and we are going to prepare only for 10 tablets. That's why I have used a very small mortar and pestle. Now we are going to mix all the excipients properly, and let's this is a lactose monohydrate, which I am pouring to the mortar, and I am going to triturate it. Now after I found that all the big particles have been gone, now it's time to mix the another filler or diluent, which is DCP or dicalcium phosphate. I am pouring it. Now I am pouring the HPMC or hydroxypropyl methyl cellulose, which act as the sustained releasing agent in the sustained release matrix tablet. Now mix it properly. Now after we found that all particles are mixed properly, then we have to pour the PVP solution or PVP slurry drop wise until the granule forms. Now we can see that granules has been formed, and now we have to sieve it through the mesh 10, and we have to dry the wet granules. Now after formation of the wet granules, you can see here we have to sieve these granules through the 10 mesh, and this is the mesh, this is mesh 10 from where I am going to pass these granules. Now this is how the granules looks like after the sieving from the mesh 10, and now we have to dry it in 60 degrees centigrade for minimum 1 hour. This is hot air oven, and we are going to keep the granules inside the hot air oven. And the temperature is 51. We are going to increase the temperature to 60 degrees centigrade. Okay, after the drying, we need to pass these granules from sieve 22, or you can pass the granules from sieve 20 also. This is the granules after the drying, and we should remember that the LOD or loss on drying should be minimum 1% or less than 1%. Now I am going to pass these granules from sieve 22. Now after the sieving of the dry granules, we have to mix the lubricant and glidant as well, and this is talc, which act as glidant, and this is here is magnesium stearate, which will act as lubricant here. Okay, I am mixing this right now. First I am mixing the talc. We have to mix it very properly. Now I am going to mix the magnesium stearate, which will act as here as a lubricant. Now after the mixing, we have to wait the granules for the final tablet. For the final tablet weight was 600 mg, then so we have to wait 600 mg of granules for each tablet. Okay, now this is the weighing balance, and we have to wait 600 mg of granules for the each tablet. Now I am going to weight the granules here. Now there it is. Okay, this is automatic tablet compression machine by Digicon Pharma Machineries, and here is called as hopper, from where our granules are poured for the large scale production. And if I open this thing is called as upper punch, and same thing is present in the downside also. That is called as a lower punch. It has two punches are there, and lower punch tip is very much bigger. This is called as tip, and lower punch tip is very much larger or bigger than the upper punch, because the lower punch helps to push the tablet from the downside, and which helps to eject the tablet. Now this is die cavity where I am going to pour the granules which I have weighted previously. Here I have compressed 4 tablets for the demonstration purpose. Now these tablets are ready for the next experiment or practical, that is evaluation study of tablets, where the tablets hardness is there, the tablets length is there, tablets weight variation is there. Next is DT or disintegration tests which we can perform from these tablets.